Okay, here we go. Our first presenter for sharing of best practice. I'd like to call on Dr. Ana Linda Belian, who is the HACT Chair of Bicol Regional Hospital and Medical Center.
Thank
Doctora.
you, Kate.
Yes, hello. Welcome po.
Yes, thank you. Uh, Good morning to all the participants. So I would like to share to you this morning the best practices of our center. So we had, but before that, I would like to thank Ilde for helping me prepare these slides, and also my nurse, Miss Angela, for providing me with this cohort data. Next slide, please. So our center, which is Bicol Regional Hospital and Medical Center, which was previously known as Bicol Regional Training and Teaching Hospital, was the first treatment hub in the Bicol region. So we were first granted fund by the Global Fund in the third quarter of 2007. And as of October 2023, we have 593 active patients that are on antiretroviral treatment. Next slide, please. So these are my staff at the clinic. So we have one ID consultant, that's me, one HACT physician, which is a full-time internist that is manning the clinic, one nurse, two case managers, and one administrative assistant. Next slide. So we had two mentoring sessions with Hilde, and from that mentoring session, this was the output that we gathered. And out of the patients that we had 10 PLHIB clients included in this cohort. So as of October 15, 2023, these are the data that we gathered. So out of the 10 PLHIB that were included, 60% of them have viral load taken within 12 months after ART initiation. And out of the five out of the six PLHIV have been provided with adherence assessment and support, which is about 83.33%. However, there was no viral load test after the adherence support. So, but we are improving on this. So about 3 out of 4 of our PLHIV have genotyping or the HIV drug resistance testing. So this is 75%. And 25% of the 4, which is 1 out of 4 of our PLHIV treatment regimen was shifted to another regimen because of the drug resistance result. So, however, we still have one PLHIV with viral load. We have not done viral load test 3 months after switching to another regimen. But this patient will be scheduled for genotyping in the coming months. Next slide. So from that data, we have this root cause analysis. So our question now is, because of the limited access for viral load within 6 months after adherence support and switching of ART, we have formulated these two questions. So why do we have limited viral load testing? Because most of us in the treatment hub know that there is a very limited supply of viral load cartridges, because for the longest time we have been very dependent on the support from the national government. So we just wait for them to download viral load cartridges, and if the supply is limited, then we cannot do all the viral load testing for all our clients. Second, our hospital has no budget that is allotted for us to be able to purchase our own supply for viral load cartridges. Next slide, please. So how about our problem with genotyping? So we have formulated 4 questions. Number one is the long waiting time for genotype schedule, because we only send our genotyping or the HIV drug resistant testing to our IPM, and sometimes we have we cannot get schedule at as soon as we want to. So because we are also dependent on the availability of their test. So second, why? Because this genotyping also costs about 4,500. So our clients will have um, to to pay from their own pocket. So, however, our hub are also helping them to be able to come up with the amount. However, some of them does not want to submit the required document, which is the indigency certificate that is needed for them to be able to avail of the government-supported funding. The third question is that patient feels that they are not ready to disclose their HIV status because before they can get the indigency certificate, they have to be interviewed in the barangay or by the medical social service for them to be able to access the funding for their genotyping. And the fourth question is that because they have to get the indigency certificate from their barangay, respective barangay, they have this fear that probably if they disclose their status, the barangay officials will not be able to guarantee them their privacy and confidentiality of their information. Next slide. So from that questions, we want to improve our we want to accomplish some improvement by setting a performance measure of about 95%. So these are the rundown of our objectives and the performance measure that we want to attain. Next slide, please. So from the improvement objective number 1, 3, and 6, these are the inputs that we have already formulated or already implemented to be able to improve our performance. So first, because of the very limited supply of viral load from the Department of Health, we asked the um, administration of the hospital to provide us budget for us to be able to secure viral load cartridges. So for this year, we were able to secure funding for this, and the first viral cartridge delivery was in August 2023. So from then on, we were able to do viral load testing more frequent. And this is ongoing, and this will last until December 2023. So, and we have found this to be very effective. Next slide, please. So, our hospital was able to provide us with a 2.5 million budget taken from the Gender and Development Fund of the hospital. So, we were able to procure 72 kits, which is equivalent to 720 cartridges. That is already enough for the whole year supply for our clients. Next slide, please. So as of now, we still have 418 cartridges that we can utilize until the end of 2023 or until the first quarter of next year. Next slide, please. So another thing is because we already now have a lot of supplies of viral load cartridges, we increase the frequency of testing. So our schedule of viral load testing before when we still have limited viral load supplies, we only test viral load 3 times a week. So the patient will have to come back for their testing if their clinic visit does not coincide with the viral load schedule testing. So now we have increased the frequency to daily schedule since August of 2023. Next slide, please. So from our schedule before of 3 times a week, half day schedule, we have now, next slide, paki-click po, next. So from 3 times a week, we now have a daily schedule of Monday to Friday and from 8 a.m. to 4 p.m. So that the patient will not come back for their schedule, because every time they visit the clinic, there's a scheduled viral load testing. So this will be this will improve their compliance with viral load testing. Next slide, please. So another thing that because of the problem of the indigency certificate that is needed for the support for the genotyping, we plan to orient the barangay point person or the barangay captain, which is the one signing the indigency certificate, about the patient confidentiality when they get their indigency certificate for the support for their genotyping. So we plan to do this in January 2024. Next slide, please. So these are the study worksheet. So from the first QI mentoring we had in October and the second in November, so there's no additional client enrolled under the second and third line regimen. Next slide, please. So for our adherence assessment and support, so from our performance of 83.3% in October, we were able to improve this to 100% in November. So all of our patients underwent adherence assessment and support. Next slide, please. So for the 4 patients that underwent genotyping or the adherence support, and we were able to do viral load testing within 6 months after adherence support. 2 of those patient clients, their viral load are undetectable, and 2 have viral load of more than 1,000 copies. And these clients were scheduled for genotyping for this month. Next slide, please. And we have no additional clients referred for genotyping from October to November. But the two clients that I had mentioned earlier with more than 1,000 copies, then we will schedule them for genotyping this month or next month. And there were no additional clients whose treatment is switched due to treatment failure. So we only have 1 client shifted from another regimen due to treatment failure. So for the viral load, we were able to do viral load testing 3 months after switching to ART regimen. So this is 100% performance. So now, moving on, we want to continue to lobby for budget. Hopefully by next year, we will be able to get another support for viral load testing so that we will not be dependent on the support from the government, and we will be able to continue our daily viral load testing. And then continue our current clinic schedule of daily testing. We plan to conduct inventory management because we don't want our hospital to cut the budget because we were not able to utilize, or that the viral load were not utilized properly. So this will be taken care of by our inventory management. And then we will start to coordinate with medical social workers and the barangay officials to help our clients to be able to secure the indigency certificate without them hesitating that their information will not be properly handled. So we plan to conduct initial stigma and discrimination survey on the barangay offices or the government offices that are directly involved in this indigency certification. Next slide, please. So that's the end. Thank you.
Thank you so much, Dr. Billion. I'm so happy to see your progress, no, and yung improvement natin. And I am wondering, so I would like to take this opportunity to ask some questions. Dr.
Okay.
Janice, if you would also have some questions, please join me. But Doc Belen, I'm really interested in you using another source of funding for procurement of viral load cartridges, and this is your GAD fund, no? Ito po ba is it something that's a line item in all public hospitals?
I think so because in every hospital there's usually funding for GAD. And part of the funding, you can utilize it for HIV, I think. So because the funding and in the hospital, they were divided into the support for the women and children health, mental health, and one of those, we were also given budget as a treatment hub. um, I think it can be done if just you just have the right reasons
Right.
to present to the administration. Yes.
And it's nice to hear that your administration was actually supportive of actually using the God Fund for that. May I ask if is this because na-maximize nyo na po yung OHAT benefits ng pasyente kaya hindi natin siya magamit, and or is the viral load cartridge such a great expense na hindi kasya yung yung OHAT nila?
Mm. Yung the viral load cartridges really cost a lot. So yun nga, 2.5 million budget. That's only good for 720 cartridges. No, so if we will use our OHAT funds, so majority of the funds will go to the viral load cartridges, and we cannot use the OHAT for other purposes like procuring of other OI meds and also some vaccines, and also we also use our OHAT funds to for the salary of some of our clinic staff because not all of our staff have plantilla position.
I
So
see.
ayun.
Yeah, I understand na if we get it in bulk from OHAT, mauubos lahat, no? There might not
Yes.
be some left over. And it is in these cases where we kind of need to think of another funding source with a higher than usual budget amount. And I'm glad na you thought of that. So kudos to you, Dr. Belen. We do have some questions here in the chat related to your talk today. And sige, ask natin. So Dr. PJ is asking, what justification did you use in the budget narrative po to obtain the viral load funding from GAD? How it was framed since the stigma of HIV is quite strong. Did it matter po, ma'am, in your request, your formal request to the office?
Surprisingly, I did not have a hard time convincing them to grant us this funding because probably yeah, because our treatment hub was, as I have mentioned earlier, was the very first treatment hub in Bicol. And because of that, the admin really since then was very supportive, but this is the only time that I thought of asking for funding for the viral load, because before we only are very dependent on the supply from the government. So in terms of justifying, I didn't have to justify. I just asked if they can grant us fund for our viral load cartridges, and they were the one who um, who suggested to get the funds from the Gender and Development Fund. So I was not the one who um, who looked for the fund from where it will be taken from. So yung admin mismo yung
Nice.
suggest that we get it from the GAD fund.
All right, that's great. So once again, thank you for sharing that, and congratulations on the noted improvement in your performance measures, and keep up the good work po. Thank you.